Today, the Ministry of Health hosts Women Health Village. This is an observance of International Women's Day right here at the Police Training Center, which is located on Camp and Carifesta Avenue. Some of the services would have include HIV testing, breast examination, VIA, and much more. Also in attendance was Minister of Health, the Honourable Frank Anthony.
I'm very happy to stand here this morning to bring welcome remarks to what is a yearly event, but every year we consider it to be very special. Not because we think as women we're more special than men, but because in the midst of all the hustle and bustle, sometimes we do not take enough time to sit and appreciate very simple things like the presence of women in our lives. And under the health ministry, we consider women to be a very essential part of the family, a very essential part of society because of what they contribute. And we have been working very hard over the years to look at ways in which we can keep our women healthy so that they can contribute to society. Yes, it starts from, not even from birth, it starts from conception, in which the role of the woman becomes so important. And as the child grows and the child is nurtured, and as husbands come into play, the role of women even expand. And we even look at the role of the older women in passing down traits and passing down different family secrets for some persons, but different family values that in itself allow society to have that moral structure that we enjoy within our country. And for most of you who sit in the room, you know that the person who has, in many cases, become the disciplinarian, the person who looks at your etiquette, the person who checks in on the schoolwork, in most cases is your mother. And the person who goes to school when you're in trouble also, if I can remember, was the mother. Because you never wanted the father to go for the reasons. But when we look at today, we do not want to just observe it under the theme, count her in and invest in her. But we want to look broader at the investment that women also make to society. So though the word invest looks at what we can put towards ensuring that our women live longer, they have healthier lives and better quality of life, we want to also ensure that we recognize the investments that women make over the years. So today, when we have all of the other speakers and when we participate in what's happening outside, let us look at it from the perspective of, yes, the services are investment in us women, but also if we have these investments, we are then able to invest in our community, invest in our country. So with that, I say thank you very much, welcome, and happy International Women's Day.
And as women, we are multitaskers. We are beautiful, thank you. But more than that, we manage our homes, but we're also leaders. And I'm very proud to be the first female British High Commissioner to Guyana. But across the world, there are more and more women leaders. And that's because we're good. We can be good leaders. So my one message to all of you is to claim your seat. So often as women, we sit back and we have that little niggling voice in our head, that imposter syndrome that says, I'm not sure that they meant me. But it does mean you. And a country like Guyana at the moment so needs everybody participating in the workforce, including in leadership positions. So my message to you is to claim your seat. If there's a job going, go for it. If there's a learning and development opportunity, go for it. Claim your seat. You are valid. This country needs you. And don't let that imposter syndrome use your confidence. We have a huge amount to offer. Just think about the way that we manage our lives. We cook the breakfast and we look after the kids, and then we have a job as well, and we keep the whole long-term vision of our family together. Just apply that now to work. Can you imagine? We are good leaders. So claim your seat. We are needed, but thank you very much for asking me to see. Just to say one thing, the UK in the last few years has put women and girls at the centre of our foreign policy. We now have a new women and girls strategy with 3 main areas about educating girls, empowering women and girls, and ending gender-based violence. Now, the reason why we've done that is not because we're nice and it's not because we're altruistic. It's because it's the right thing to do. Because if we're going to make societies more democratic, if we're going to make societies more prosperous, we need women to be not only participating, but taking leadership roles. So it's always a pleasure to be invited here. So everybody, claim your seat. Thank you.
First of all, allow me to wish all of you a happy International Women's Day. And also, if you didn't know, today it's another holiday that we also celebrate in Guyana. And that is a Hindu holiday that is called Mahashivratri. So it's nice to have 2 of these holidays coinciding together. We're happy to have this particular program every year. And I think one of the reasons why we're doing it is that we want to focus on women's health. And we want to use the day, since the day is well recognized, to get people to focus a little bit on women's health. In the ministry, we have a department that deals with women's health. But really, it's throughout the entire public health system. And I want to use the occasion to talk about a couple of things that we want to focus on. One is that we understand from the stats that we have that breast cancer is the #1 cancer among women. And the second one is cervical cancer. Breast cancer, we do a lot of activities in terms of highlighting it, but we don't take the next step. Having raised awareness to get people to come in and do the things that are necessary so that we can monitor to see if anybody, or screen people to see whether or not they have breast cancer. And so this is one of the things that we want to encourage people to do. We want them to come in, get their mammograms, and if you detect a lump, to be able to come in and let's check that, and maybe even to do a biopsy so that we can set your mind at ease. And even if we find something that is cancerous, that we can find it early so that we can take action. And that is very important, because if you come too late and you already have metastasis and so forth, it is going to be harder for us to work with you. And therefore, I think, apart from us raising awareness, which we do very well during October, I want us to use the whole year where we can raise awareness but bring people into care, or bring people to be screened so that we can offer our services. The other big challenge that we have among women is cervical cancer. But this is something that is caused by a virus predominantly, and it's something that we can actually eliminate from Guyana. Because it's caused by a virus, we have a vaccine that is available, and if people take the vaccine, it can prevent them from getting cervical cancer. Unfortunately, while the vaccine has been available, a lot of people have not really taken the vaccine. So this year we have a program in the ministry where we want to push so that people can come out and get the HPV vaccine. And we want to have this across the country, so there's no excuse. Access would be there, people can go and get the vaccine. Traditionally, we had focused on people, or on children between 9 to 15. And we want to extend that because the new guidelines from CDC in the US and other, like the WHO and so, would have said that we can extend it, the age group. So not only do we want to focus on people between 9 and 15, we also want to look at persons between 16 to 45. And all of them can be eligible for these vaccines because the evidence has shown that these vaccines can change outcomes, prevent people from getting cancer. Now, I want you to think about this. This is the number 2 cancer among women right now. But if we have a very strong immunization program where we are able to get at least 90% coverage of all those who are eligible, then we can prevent cervical cancer from happening in Guyana. This cancer that is now such a big threat among women today in Guyana, we can actually relegate it to not being a threat at all. But we have to we have to encourage people to get vaccinated. So if there's one message I want to leave with you today, is to make sure that we encourage others. And if you are eligible in terms of age, go and get the vaccine. I'm sure they would have them here today in this fair. Make sure you go and get the vaccine because it is going to protect you. And we need to encourage others to take the vaccine as well. We also recognize that we need to screen people. So we have been using VIA, that's visual screening, using acetic acid, but we also have pap smears. And we have bought a lot of the equipment to do cryotherapy. So if when we do the screenings, we see abnormal cells, they can actually do the cryotherapy right there for you. We have these clinics now in every region. Again, the challenge is that we are not seeing a lot of women taking up these, coming to clinic. Maybe people don't know. So if they don't know, we want to use every opportunity to inform people that these clinics exist. People can come out and get these services. And if you screen and we detect abnormal cells, then again, we can take the necessary steps to prevent that from becoming cancerous or whatever. But we need to screen early. Now, one of the things that we didn't have available, at least in the public sector, was an HPV test. This was available in the private sector, and it would cost someone maybe about $25,000 if you want to do an HPV test. I would say it's beyond the reach of a lot of people if it's $25,000. So if they're not coming for the free VIA and the free pap smear, then I don't see them going and spending $25,000 to do a HPV test. Now, in today's fair that we'll be having outside shortly, one of the things that we want to make available to the persons who would be coming to the fair is an HPV test. We have recently brought in the equipment, and so now in the public sector for the first time, we'll be able to do HPV tests. So please, make sure once you're eligible, I think it's between 35 and 45. So once you're eligible, go and you can have your screening. Now, if we look at the continuum, so that's screening. We want to detect people early. But also maybe we find people who might have signs of cancer. But the road doesn't end there. What we want to make sure is that if somebody needs surgery, that they can access surgery. If somebody needs brachytherapy, they'll be able to access that here. Right now, we don't have brachytherapy available in Guyana. We have to send people abroad. We have to support them to be able to get brachytherapy. But we are going to change that. In this year's budget, we have set aside money to build our own center so that we can have brachytherapy available in Guyana. So this is something that we'll start now, and it might take us a little bit to get it done, but this is something that we're committed to. So once we detect someone the pathway. We can still work with them, we can treat them, we can do a number of things. And more recently, about a month ago, we opened a new path lab, a pathology lab. So before, if you had to do a biopsy and you take the sample and then you send it to our lab, they probably took 3 months to give you back the results. By which time you're worried, you know, you want to know what's going on. Is this cancerous? It's not cancerous. What's happening? And 3 months is a long time. We have reduced this time to within 24 hours to maybe 4 days, max 4 days. So that's the new pathology lab. But some of the things that they're able to do there now is something we never had before. So if we want to differentiate, let's say, the different types of breast cancer, because there are different types, some that are more sensitive to certain hormones and so forth, then we didn't have that capacity. So we were doing very crude diagnosis. We have changed all of that because we can differentiate now the different types of cancers using various types of markers. And we can do that now at our lab. The difference here is that the lab is probably one of the best labs, if not the best lab, in the Caribbean at this point in time. And if we don't have the expertise here, we have another component of the lab where we are doing what is called now digital pathology. So we take high-resolution images of these specimens, and then we can send it to experts in other countries who can read it for us and give us an interpretation. We have a very close collaboration with Mount Sinai, so we are sending our samples to them, and they are able to read it and give us a second opinion. So this is now all available, and I'm sure very soon, as people learn in the Caribbean that we have this type of capability, that we'll be seeing samples coming from those countries to us for us to do this type of work for them. So we're steadily making progress. We also, while we are looking at cancers, one of the other things that we want to look at is to make sure that persons who are suffering or who develop chronic non-communicable diseases, such as diabetes or high blood pressure or heart diseases, can come in for treatment. Now, women generally are more attentive to their health, so we see more women coming to our clinics. But yet we also have a problem with adherence, because they come sometimes and then they don't come back. We still have a problem with diabetes in our country. And while we have changed the guidelines, and we are now using as a standard HbA1c, that's glycated hemoglobin, versus maybe just what you're getting from a glucometer, this is a new standard. We want people to understand what's happening with their blood sugar, whether they're pre-diabetic, and if they're pre-diabetic, what steps that they can take to prevent diabetes or delay the onset of diabetes. But for that, we need people to come into our clinics, to talk to the doctors, to get an understanding of what's going on with them. We also want to look at high blood pressure. Right now, we have a program that we're running called HEARTS, and it's in all of these health centers. And we have changed out the medication, so someone who is hypertensive, we can have better management using more effective medication. But if people don't come, then we're back to square one, right? Because while we have the facility, people are not using the services, and we need to change that. So I want to appeal to you, if you know people with these conditions, get them out to our health centers so that they can benefit from these services. Last year, we spent quite a lot of money helping more than 700 persons to get stents. They came to the Georgetown Hospital. We were able to give them a stent because they were having a heart attack, they needed to get stents. So about 700 persons we helped. these can be prevented. They can be prevented because if we're working with you earlier, we can prevent some of these things from happening. So we have a lot of systems now in place. What we need people to do is come and make sure they get these services. We also spend a lot of money on contraception, and we have them available. And we've been talking to people about them. But again, if persons want these services, they're available free of cost by the Ministry of Health. And not just in Georgetown, but across the system. So there are lots of services that we offer, and we really want people to benefit from these services. So as we celebrate International Women's Day today, we want you to think about how you can help us to spread this message. First of all, make sure that you go and access these services and utilize them for yourself, but then also bring along other people who can benefit from these services. And I think if we do that, we'll have a healthier population. And that's the ultimate goal here. We want people to be healthier. We want people to live longer. You know, you're seeing a lot of changes now. Prosperity, we're seeing things happening. We want people to live longer to enjoy all this prosperity. We don't want people to die prematurely. So as we improve our life expectancy so that people can live longer, the other goal would be that we must improve the health expectancy, meaning that people must live longer, healthier, and so that they can enjoy the best of their life. And that's what is important. And we can do this if you come in, get your regular checkups, pick up issues early, fix them early, so that you can have a good, healthy life. So on this 8th of March, I want to wish not just a happy International Women's Day, but a healthy International Women's Day. Thank you so much.